my name is Scott McMullen, and I'll be presenting our pediatrics group project over leukemia today. And and of course, none of this could be possible without great group members and the great help of. So our group is consisted of Stephanie, Maya, Jordan, Holly, and Abby, and myself. So let's learn a little bit about leukemia. So what are some of the objectives? So today. We'll learn about what is leukemia. What are those statistics in leukemia in children? The signs and symptoms of leukemia. Of course, we'll look at some of those treatment options and leukemia mortality rates. And we'll look at end-of-life care and, of course, those effective coping techniques that may help somebody with a family member that has leukemia. And we'll also look at a interactive case study to help along and try to put it together. So what is leukemia? Leukemia is a cancer of the white blood cells. And those white blood cells are also named leukocytes. And when normally they help fight off those infections and those diseases. But when you have leukemia, those leukocytes are abnormal, and they crowd the bone marrow, and that's when they get into the other side of the bloodstream. And usually white blood cells, like I said, help fight those infections. But when you have leukemia, those abnormal white blood cells, they can't protect the body from those infections or even diseases. And when you have those leukemia get into the bloodstream, they can spread from the bone marrow to the other parts of the body. That can be your chest, your brain, your liver, your spleen, anything that blood flows to, it can actually affect. Leukemia is actually the most common type of cancer in children. And the most common type is acute lymphoblastic leukemia. That actually affects the lymphocytes, which is the type of white blood cell. And the acute myeloid leukemia, which affects the blast cells, which is again kind of an immature white blood cell. But most leukemia cases fall into two categories. You have chronic leukemia and acute. And of course, chronic involves those partially mature or those mature white blood cells. And it is a very slow growing cancer. But it's also really, really rare in children. The most common, like we said, was the acute style. The acute leukemia impacts the immature cells. It's really, really aggressive and makes up the vast majority of all leukemia cases in children. So let's look at some of the stats. In the United States, around 3,500 children are diagnosed with leukemia each year. And from 2012 to 2016, on average, a little over 3,700 children and adolescents younger than 20 were diagnosed with leukemia every year, including 2,761 diagnosed with the acute lymphoblastic leukemia in the United States. And like we said before, acute lymphoblastic leukemia is the most common, and it makes up 75% of all children that have leukemia cases. It is also the most treatable type of leukemia that we have as well, with a 5-year success rate around 90%. Acute myeloid leukemia is, of course, the second most type that we have in childhood leukemia. The disease 5-year survival rate for pediatric patients is around 65%, though it kind of differs from subtype to subtype of leukemia as well. And that, of course, is based on the chromosomal changes of the cancer cells. So let's look at some of the signs and the symptoms of leukemia. When you have a child that has leukemia, they look really pale. They look really white, and they have persistent fatigue or weakness. They have really, really shortness of breath when they're playing outside or they're running around, things like that. They feel really, really tired or short of breath. And of course, they have a bone pain. Their bones feel really, really tender to them as well. And they can have some of them can actually have a limp. most complain of like the fever or chills, or uh, this. They can even have like swollen lymph nodes, in the neck, the groin, the area, and of course they have belly pain as well. And a lot of times they can even look at, they sweat a lot. They have a really excessive sweating, especially at night. So, uh, so that's some of the signs and the symptoms of leukemia. So let's look at a question. So a patient has recently been diagnosed with leukemia. Which of the following symptoms would a healthcare professional expect to see in a given diagnosis? A. Bruising, fatigue, and bone pain. Bradycardia, hypertension, and palpitations. Paresthesia, facial rash, and abdominal pain. Dyspnea, malaise, or hypotension. Of course, the answer is A. Bruising, fatigue, and bone pain. So we know kind of what the signs and symptoms are. So let's look at diagnosing leukemia. What are some of the things that the doctors do to help diagnose this cancer? So a lot of times they'll do a physical exam, and they'll look at the pale skin and the swollen lymph nodes, and of course they'll look at even the enlargement of like a spleen or a liver as well on their physical exam. The doctor will also order a blood test and see what kind of test is coming up. They'll do a bone marrow biopsy and a spinal tap to see if there's anything in that spinal fluid. And of course, they'll do X-ray testing as well to see if there's any changes in that bone marrow. And of course, they'll do genetic testing as well. So another question, the patient is with a diagnosis of leukemia has been admitted for observation. Which of the following assessments requires immediate interaction or intervention? A. A temperature of 100.4. A loss of a kilogram over 4 days. C. Pale, dry, mucous membranes. D. A complaint of fatigue. And the answer is A. Temperature of 100.4. Means they're trying to hopefully not get, they're showing signs of infection. Another question for you. In formulating a nursing diagnosis of a risk of infection for a client with chronic lymphoid leukemia, nursing measures should include, and of course, select all they apply. So A, maintaining a clean technique for all invasive procedures. B, placing the client in protective isolation. C, limiting visitors who have colds and infections. D, ensuring meticulous hand washing by all persons coming in contact with the client. And the answer is B, placing the client in protective isolation. C, limiting visitors who have cold and infections. And of course, we got to have D, meticulous hand washing with a person that is coming in contact with that client. So what are some of the treatments that we see with leukemia? In childhood, the main treatment that we see is chemotherapy. Those doses and those drugs may vary, on the age and the type of leukemia that person has. Radiation therapy, those high energy X-rays, those kill those cancer cells, and we could have targeted therapy as well. Those are going to be where that specific drug that find and attack cancer cells without hurting, those normal cells as well. And then we could have stem cell transplants. We're putting those healthy stem cells back into the body as well. So another question for everybody. The nurse analyzes the laboratory values of a child with leukemia who is receiving chemotherapy. The nurse notes that the platelet count is 20,000 microliters. Based on the laboratory result, which intervention will the nurse document in the plan of care? A, monitor closely for signs of infection. B, monitor those temperatures every 4 hours. C, initiate protective isolation precautions. Or D, use a soft, small toothbrush for mouth care. And of course the answer is D. You want to use that soft, small toothbrush for that mouth care. You definitely don't want to initiate any bleeding problems there in the mouth. Another question. A client with acute leukemia is admitted to the oncology unit. Which of the following would be the most important for the nurse to inquire? A, you have noticed a change in sleeping habits recently. B, have you had respiratory infection in the last 6 months? And have you lost C, have you lost weight recently? Or D, have you noticed changes in your alertness? The answer is B. Have you had any respiratory infections in the last 6 months? That's going to be definitely important for a person who's had acute leukemia. So hopefully none of those infections transfer over. So what are some of the mortality rates that we see with children with leukemia? In leukemia, kind of that age-adjusted death for children, adolescents and young adults younger than 20, we've actually declined by 78.6% by 1969, which is a wonderful thing. But leukemia is still the second leading cause of death among children younger than 20 years old. And it accounts for 26.1% of all cancer deaths in children. So next, let's look at some end-of-life care for leukemia. You know, we talk about palliative care, and that's introduced when we have our leukemia patients that have those treatments and they were just unsuccessful. And treatment refocuses on curing that leukemia or that cancer to kind of maintaining the client's comfort levels. But it doesn't mean that we're not going to give up on medical treatments. Chemotherapy is still available, and of course, parents can use those experimental, include some of those experimental therapies as well. And a healthcare team is hospitals palliative care. They have those case managers there to help manage that end of life care. And that team can include nurses, of course the provider, that's psychologists, occupational therapists, social workers, and of course music therapy as well. And of course, as our job as nurses, we establish those goals of care and identify what is important to the family and that child. We help them plan that end-of-life care in the family's preferred setting. And we ensure that child is comfortable. And of course, we provide support for all the family members. We're not just there for the one person, the patient. Kind of everybody is a patient in some kind in this format. And then of course, we'll have a non-judgmental attitude towards any of the treatments that the parents want to pursue. And then of course, we'll teach information about what are the support groups that are out there, what are some of the other beneficial help that we may be seeing in other places that will help those individuals. So let's look at some of the coping techniques for a child that has leukemia. Your child's treatment can affect the entire family. When a person's going through any type of cancer, it affects the entire family. It can be as you're going to the hospital or going to a clinic a lot, and it may make you feel really, really anxious, or it will make you feel really, really fatigued as well. And of course, knowing that your child could die, you're going to have a combination of that sadness, that guilt, that anger, as that child's treatment goes on. So, your dynamic may change after your child's been diagnosed. And so let's look at some of those coping techniques that can help some of those families. So first and foremost, be active in that child's treatment plan. And be familiar with it as well. Learning about leukemia can definitely help you feel a lot more confident um, about caring for your kid. You know what's kind of going on. Keep a positive attitude. Um, keep that hope going along and help provide that emotional security for yourself, um, the rest of the family, and of course, first and foremost, that child that's going through it. And set a routine. Routines can actually give us a lot of structure and help us maintain that sense of control. And of course, be flexible and patient, which can be really, really hard to do. Um, you really want to take just one thing at a time. There's no way to know how to predict how your child will cope, how the treatment's going to go. Just take it one day at a time. Be flexible, and sometimes patience can help in this. And accept help. Caring for your sick child is going to be hard, especially when you're trying to manage possibly other kids, your household, your work, and it may be more than you can handle. See if sometimes that you can have somebody help you out in certain situations that'll help. Maybe somebody can clean your house for you. Things like that can really benefit and make you feel a lot better, a lot less stressed. And then, of course, finding the balance between overprotecting and overindulging your child. Um, try to find a balance between setting too many restrictions or not enough restrictions. Still let your kid be a kid, but remembering some discipline is definitely going to be necessary. So let's look at our interactive case study of leukemia. So we're going to follow along the presentation. You're going to be able to follow questions regarding the patient and the treatment. And definitely write down your answers as we go through it and see if how well we do with some of the answers. And of course, there's more than one answer. It's definitely acceptable during on these questions. So let's look at the scenario. Lisa Evers is a 5-year-old with acute lymphoblastic leukemia who presents to the emergency room with a 103.2 degree fever. And she's also complaining of pain in her arms and her legs. She has been receiving chemotherapy since diagnosis of 6 months old. Her mother reports that she has a CBC that is drawn from Lisa's central venous access device, and April is admitted to the Pediatric oncology unit. You, as a nurse, are responsible for taking care for Lisa. So let's look at Lisa's chart. Our temperature is, like we said again, it's 103.2 degrees. Our O2 sat on room temperature is 98 degrees, or 98%. Our pulse rate is going to be 120 rates per minute. Our respirations are going to be 30, and our blood pressure is 120/80. And Lisa is weighing at 38 years old. Her height is 34 inches, and her allergies are ampicillin, and her last dose of acetaminophen is 7.5 milliliters 6 hours ago. So, what is acute lymphoblastic leukemia, and how does it affect children like Lisa? And so, write those question answers down. What are some of the typical signs and symptoms of children with acute lymphoblastic leukemia? So, when meeting Lisa, you can tell she is distraught. She holds her mother and doesn't make any direct eye contact. When evaluating Lisa's pain, you decide on the FACES pain scale what is the most appropriate. Since Lisa is not in the mood to talk to an unfamiliar nurse, Lisa picks the crying face. So apparently it hurts. Number 3, as a nurse, how would you interpret Lisa's pain, and what about her chart concerns, as you're the most and must be treated immediately? So the physician ordered ibuprofen 90 milligrams dose per 6 hours. The bottle reads 5 to 10 milligrams per kilogram per every 4 to 6 hours and comes in 100 milligrams per 5 milliliter solution. So is the order in the safe dose range? And if it is, number 5, how many milliliters would you administer to Lisa? So we'll continue our case study. So as a nurse, you would wait how many minutes before returning to reassure the patient's pain? While reevaluating Lisa, you collect the following information. Her temperature has dropped to 97.6 degrees. Her pulse is now at 100. Her respirations have gone down to 22. Her blood pressure now is 95 over 75, and her A2 saturation is at 98%. So after reviewing the following information, you can conclude that the medication was effective. Lisa is now playing with her doll and while laying in her bed. When she sees you come in, she quickly turns the other way and hides her doll under her sheets. As a nurse, what are some of the therapeutic forms of communication you could use with Lisa to build rapport? You finally received the following lab results that were ordered in the emergency room. Complete blood cell count. Red blood cells at 2.8 hemoglobin, 8.5 hematocrit, 29% white blood cells, and 4.0 white blood cells at 4.0 and platelets at 80,000. So identify those lab results and what are considered abnormal. What is pancytopenia, and how would Lisa consider having it? And looking at Lisa's medication chart, you see that she has the following medications. Describe the medications below. Doxorubicin, daunorubicin, Cytosin, or rubinoside. The physician orders that Lisa stay at the hospital for a few days due to her low CBC. And as a nurse, what are some of those interventions you could implement for Lisa to make her more comfortable? Number 13, what are some of the safety measures that you must implement for a patient who has low white blood cells? So let's look at some of the answers. Acute lymphoblastic is considered one of the most common leukemia in children, like we've said before. It affects 3 to 4 children with leukemia. It primarily forms in the white blood cells, lymphocytes. It is considered that acute leukemia. These leukemias, like we talked about, are really, really aggressive, and they needed to be treated right away. So answer number 2, this fatigue, that bone pain, that weakness, that easy bruising, somebody who's limping and not using those, those affected extremities that maybe happen. You can have swollen organs or that low and high blood count, white blood count. And of course you can have those purple spots all over you as well. So number 3, you would interpret it as a 10. When you have somebody who is crying on that face, that pain must be really, really bad. It hurts the worst. The most concerning is her temperature, her heart rate, and of course her blood pressure and her respirations. They are increased. And of course her fever should be treated immediately, especially that 102.7 degrees. Number 4, yes, the dosage between 86 milligrams and 173 milligrams per dose every 6 hours is a safe dose range. And you would administer 4.5 milliliters. And how long should you wait? 30 minutes to reassess her for that pain and see if she's gotten better. Number 6, we can talk in a calm, soothing voice. Ask her about her doll to make her feel more comfortable. talking to the doll in front of Lisa and asking the doll questions, or showing that doll certain procedures that we may be doing, like taking the temperature of the doll, uh, and of course let Lisa play with pretend medical equipment so she can build that confidence is something that she may be getting as well. And of course, make sure that you're on their eye level as well, using simple words and explanation to what is going on. And let her make choices about what food she wants. If you give her something that maybe the mean nurse that gives her something that she doesn't want. If you try to get my son to eat broccoli, guess what? He's probably not going to like you very well. Number 7, all labs are definitely abnormal, especially low in some cases. And number 8, pancytopenia is a medical condition in which there is a decrease in the number of red and white blood cells, and of course the platelets as well. Everything is low. All 3 must be low to have it. Number 9, doxorubicin is an anti-cancer chemotherapy drug. It's considered a anthracycline antibiotic, which stops the growth of those cancer cells by blocking the enzyme called topoisomerase 2. It can be used in combination with other chemotherapy drugs as well. Doxorubicin is a medication used to treat cancers like acute lymphoblastic leukemia, used in combination with other chemotherapy things, and has a anti-neoplastic activity as well. Cytinibine, or arbenicide, is a chemotherapy drug that is used in combination with other chemotherapy drugs to help acute lymphoblastic leukemia, and is a anti-metabolite agent, which inhibits the DNA synthesis. So our answer to number 12 is try being readily available to Lisa and her mother. Encourage those patients to eat small, frequent meals, and try to include some of her favorites. Like we said before, allow to keep her doll. Let her use that doll to help you with her. That can be a great gateway to helping you build that rapport. And of course, provide appropriate age-related activities. Promote that open communication, and recognize developmental tears as a association with that illness. She may not be feeling well. She may be in a lot of pain. Like that faces that were crying, she could be crying just for that pain as well, or it could be the unknown of what's going to happen. So it puts a lot of stress on a child. And number 13, safety measures you can implement are restricting all visitors with any kind of healthcare providers with any kind of acute infection. You don't want to have them near. You're not going to allow any kind of fresh fruit or flowers to enter the patient's room. That can actually bring in bacteria and make Lisa more sick. So that's something that you don't want to have. You want to provide that room being germ-free environment, and you want to follow that very strict hygiene protocol. You want to wash those hands really, really well before you are help working with a patient with leukemia. And of course, fortify foods with nutrition supplements as well. If they're not eating well, that may be something you can do for a supplement that will help them get those calories, those proteins, those carbohydrates, and of course those fats to help them get better as well. And of course these are our references that we've had on our presentation as well. So I'd like to thank everybody for listening to me talk about our leukemia, and definitely can't help our group enough talk about how great they were. And thank you again for listening to our presentation as well.